Hello, listeners. Welcome back to another week of Tits Up. As always, I'm Megan, and I'm joined by my beautiful co host, Sam. Hello,
Hello.
Sam.
Hello, everybody.
You guys, today we have Heather Rasmus on again. So, last time Heather was on, we started to kind of talk about lymphedema, everything kind of having to do with like the lymphatic system and basically how it works. We wanted to have her on again, though, to kind of do more of a deep dive. So, if you haven't listened to the last episode with Heather, I would recommend pausing here, going back and listening to that first episode. We called it Lymph, Laugh, Love. So go back and listen to that episode and then come back and listen to this one because we're going to deep dive into a lot of things that we just touched on in the last episode. So, Heather, hello, and thank you for being back on the podcast.
Hello, thanks for having me back.
We love you. You can always come back. So I want to kind of hand it over to you, Heather, because when we started our conversations in the last episode, we started to touch on some pretty big issues. The biggest one, I think, would be lymphedema, what it is, how that kind of shows up in people, because it sounds like it shows up in a few different ways for people. How we can handle that if you happen to be one of the people that is affected by this. And I think that there are a few other things that we probably want to talk about. So I want to hand it over to you. Give our listeners just a real quick recap on, the lymphatic system and how lymphedema starts to kind of show up, and then we can go into what to do about it. Does that sound good?
Sounds good.
Okay, perfect.
Oh, great.
So
I'll
I'm
take it
handing
from
it
here.
over to you.
Okay, so lymphedema, it's a diagnosis of having swelling in your tissues. So it's a buildup of swelling, but it's a chronic swelling. So it's not like when you sprain your ankle, and you get fluid that builds up. That's a natural reaction of your body. Lymphedema is more of that chronic swelling. So it's the fluid that's in between all your organs. It's in your interstitial fluid. And so what that entails, it's not just fluid, but it's also kind of all the garbage. It's kind of all the particles, all the toxins, all the stuff that kind of builds up in your system. And so we use the term, part of it is your proteins. There's proteins in that fluid. And so it's a buildup of the actual definition is a buildup of protein-rich fluid. And so your body detoxifies through your lymph nodes. Those are your cleaners, and it cleans that fluid. And so it's collected by movement. So when you move, the fluid moves up to the lymph nodes. The lymph nodes then clean the fluid, and then it goes back into circulation. There's a different, how should I say? It works as well with your circulatory system. And so you think of your circulatory system like your heart pumps your blood, and that stays in a closed system. Think of kind of all the extra fluid around, not in your blood system, would be part of your lymphatic system, and it entails it's part of your immune system.
Okay. That's a really good recap. That explains all of that. And it makes me want to move more, because I think you said last time, like your circulatory system, your heart is the thing that's pumping the blood, but your lymphatic system doesn't have a pumper. I guess maybe the best way to put it. So moving is the thing that moves it around. And I can't tell you how many times I've thought of that when I'm just being lazy, like a little slug at the house. And I'm like, oh, take the dogs on a walk, go move, because you need to move your lymphatic system. I never knew that was a thing.
Mm-hmm. I'd say we can kind of go through, like, what are 6 things? I kind of put a list together of ways to help your lymphatic system. So one is movement. So walking like 15 to 30 minutes a day, like 4 times a week is kind of that magic number of what they say, even to prevent reoccurrence of breast cancer. It's one of those things that you can do to help with preventing that reoccurrence. So that's one. Hydration. So hydration is really important with your lymphatic system. So staying hydrated, drinking water all throughout the day is wonderful. And also good nutrition. So really looking at like healthy fats, vegetables, kind of, we all know general whole foods, good nutrition. It's good for your system. Think of your system as it's trying to detoxify. So keeping processed foods at a minimum, and having good like healthy fats and vegetables for your body. Belly breathing, so deep breathing, is wonderful for your lymphatic system. What that does is you have your largest vessel of your lymphatic system going through your diaphragm. And so when you do belly breathing or deep breathing, you're actually like stimulating that lymphatic fluid to move from your lower body up and get back into your circulation. So what that looks like is, we can all do it together, putting your hand on your belly. So what you're going to do is expand, breathe in, but you're going to try and move your hand up, right? You're trying to get your hand moving. So breathe in. And then when you breathe out, push a little on your belly. Just give it a little push there. And do that about 5, breaths. That's all it takes. Try and doing that throughout the day. You can even, so you can do it, start right under your rib cage, near your diaphragm. But you can also then after a couple breaths, move your hand around. So go to like your right side, then go like right above your pelvis, like move around your belly, and do some belly breathing that way. It's a good way to also kind of get in touch with yourself. And so feeling for congestion. I had a client just yesterday that was like, I'm really feeling congested there. So we did some more belly breathing, some more massage in that area. So you can actually start the process of feeling for congestion. And you're just feeling for kind of like a thicker congested area. Another thing is massaging those lymph nodes. So there are different areas on your body where you have lymph nodes, and where they are like on your neck. So behind your knee, behind your ears, and like above your clavicle. So that's one area. Then you have in your axillary area or your armpit. And then the other area is right at your hip, where that crease of your leg, the
Yeah.
top crease of your leg. And so what you can do there is just touch, massage. So you're doing circles. So doing like 5, 8, 10 circles at a time. Sometimes we call them pumps, but really just getting in touch with kind of, touching that area. So doing circles around your neck, doing circles around your armpits, and then doing circles right around kind of your groin, right where that crease is. What you're doing there is stimulating. You're waking up those lymph nodes, which, right, those are your cleaners. And then 2 more things on the list. One would be avoiding pollutants. So why I like to talk about this is I think there's so many things kind of in our day that we don't even notice that kind of can build up with toxins. So looking at like your cleaners throughout your house, like are they like really strong chemical cleaners? So maybe avoiding that and starting to use like vinegar and water. Looking at your beauty products, how many fragrances are in your beauty products, right? We put on soaps, we put on lotions, we put on makeup, really trying to look for like a clean beauty product is wonderful. Another, laundry soaps, dishwasher soaps. All these are kind of, it just adds up throughout the whole day.
Isn't there
And then the last,
Sorry, I don't mean to interrupt, but isn't
yeah.
there a website that you can go to and it like rates
Mhm.
all of the different like cleaners and makeups and all of that?
Mhm.
Do you know what that one's called?
There's tons of them. There's actually, I actually use like different apps, like clean product apps. So you could just kind of research those, some good clean product, and it's an app on your phone, and then you can scan when you go to the grocery store. You can actually scan the barcode, and it's going
Brilliant.
to give you a number.
I
Mm-hmm.
love that.
So you can see, yeah, like a lot of them, like it's like it'll give you like a green number when it's like kind of a good cleaner product versus like a red. Um, number to let you know, hey, this is kind of this has, and then it will tell you all those chemicals that you're kind of putting on your body. And like with anything in life, like you can have like 1 or 2 kind of things that, you really love and you want to use that one. I think the issue comes when you're adding them up all together,
Yeah.
right? Like you go to do your dishes in the morning and you're that whiff of like, I don't want to name any brands, but like those strong chemical smells, like you're taking them in, right? And then you do your laundry, you put on your clothes, then you're cleaning, then you put on, it's just, it kind of all adds up. So they're saying to really be aware of just how many chemicals, fragrances, alcohols, things that we're putting on and around our body. And then the last thing that can really help your lymphatic system is just managing stress. So looking at, just how stressful we are, and um, yeah, we were just talking before the show how busy kind of and things are adding up, but trying to find time for yourself to do that breathing, meditating, exercise, whatever it is for you, yoga can really help with your lymphatic system.
I have a quick question about like the locations. You were explaining like the neck
Mhm.
and like under the armpit and then like kind of in the like
Mhm.
groin area where your hip meets your leg. Um as cancer patients, we tend to always just think about the ones in our armpits, right? Like that's the one that they test to see if the cancer has spread outside of your breast or anything like that. Is that a place that let's say somebody that's currently going through treatment versus somebody like me who's been out of treatment for about 2 years, is that something that you want to focus on the most, or is that something that you would not necessarily focus on because like it's kind of that pain zone, right after surgery or whatever? If you're going through treatment, I remember that I was really scared to touch anything really from the neck down, but like especially the armpit lymph nodes. What are your thoughts? Like, give it the most attention or give it a minute and don't give it attention for a while?
Yeah, that's a great question. So in short, yes, I would give it the most attention. When if you're talking about you had breast cancer on the right breast, you would give the most attention to that quadrant, or I guess that the axillary lymph nodes on that side. Um, I'll take it back a little. It depends how many lymph nodes you had removed. And so a lot of times now we're doing just that one or two lymph nodes that gets removed. They put the dye, like a blue dye, into the area of where the tumor was. Then the surgeon will go in and look for a lymph node that is blue, because that node would be the node that's cleaning or clearing fluid from that site, right? And then they
Mhm.
remove that. So it could be one or two lymph nodes. They test it for cancer. If it's negative, then they stop there. If you had to have a lot more lymph nodes removed, like we're talking like 16, 18, I mean, however many lymph nodes more, if they were finding more cancerous lymph nodes, yes, you can still massage and do those pumps and do those circles. But what's really important in that area, or in that example, would be to also do the massage on that side of the neck. So we're talking right side. So do massage the right side of the neck so that you can stimulate those lymph nodes, and then also do that right groin. What you can do then is actually push fluid out of that quadrant towards those lymph nodes. What you're doing with that is you're taking away the work of these lymph nodes to try and process the fluid. How you can kind of think of it is your armpit lymph nodes, your axilla is your armpit. So I'm going to say from now on, kind of your
Yeah, yeah.
axillary lymph nodes is your armpit. So your axillary lymph nodes, think if they had lymph nodes removed, all those other lymph nodes need to do the work of what they were before. So say there was, we'll just say for easy, 50 lymph nodes there, right? Now if you've taken away 10, 15, 20, there's only 30 lymph nodes in that area left to do the work. And so you want to manually push that fluid away from this zone so that these guys don't have to do that work and be overworked. Because when that area gets overworked, meaning there's too much fluid for these nodes to process, that's when you're going to start seeing swelling.
So I think that's
So,
kind of a perfect
yeah.
segue into
Hmm.
lymphedema. I always thought it
Yeah.
was lymphedemia for some reason. You corrected me. Thank you so much. It's lymphedema, correct? I've got it right now.
Hmm.
Okay.
Hmm. Yeah. Yeah. Yeah.
So I think that's
Lymphedema.
a perfect segue into lymphedema. and
Mhm.
what it is, what it looks like on people, how it presents on people, how to fix it. So tell us tell us about that.
More about that.
Yeah.
Yeah, so, not everyone, so the lymphedema, where we're talking about having surgery, right? There's a primary lymphedema. I think I talked about this in the first episode, where something could be you're born with a lymphatic system that isn't working, properly. So you can be born with it. That's a primary lymphedema. A secondary lymphedema is any time that there's damage to the lymphatic system. So in that example, having lymph nodes removed, right, that's damaging or making that system less efficient. Radiation can also damage the lymph system, bringing on what then happens is you get a buildup of that fluid, and that's when it's diagnosed as a lymphedema. You want to catch it early as you can, and that's what when I first started, like 15 years ago, I would see so much more lymphedema diagnoses. And I think what's happening now is we're getting better and better at catching lymphedema early, catching swelling early. And how you can catch it early is achiness. So a lot of times, if you've had surgery, so say you had surgery, you had a couple lymph nodes removed, you've now had radiation. If you start feeling kind of this like achiness in your arm, you that's a great time to get into a therapist, start talking about lymphedema, getting tested for lymphedema. So that's how it's going to present, like an achiness, like you start seeing a very little bit of swelling, and it's going to go really slow. It's not like this puff up, but you swell right away, and then oh my gosh, I have lymphedema today. Yesterday, I didn't have it yesterday, and I have it today. So it is a slow process, like a drippy faucet. So there's two ways that you can measure for lymphedema, or test for it. One is called getting an LDEX score, and what that is. So we had what's called a SOZO machine. All it is it's internally measuring your fluid, and so you're on a scale seeing how much swelling is building up in that area. So that's an internal way to do it. You can't do it if you're pregnant, and you can't do it if you have a pacemaker or a defibrillator. But if you don't, then you get those numbers, watch those numbers, make sure that if it goes over a certain number, then you get fit for a compression garment, and do massage yourself. The other way to test for it is circumferential measurements. So measuring from right to left and seeing if you're building up with any fluid. If you are, catch it early, like we said, and get that compression garment. And sometimes the first time of wearing a compression garment is just wearing it for about 3 months, and continuing to measure and seeing if we're keeping it at bay and that swelling is not building up.
Where does it for breast cancer patients? Where does it usually build up? Is it usually the arm?
Yes, it does. It can build up in the arm. It also, you'll see it under the armpit. I'd say that's kind of like the area that people, if it's not going to be the arm, you can get it around the breast, but really under that arm, people get really, it's just like an irritant because you put your arm down, you're like, oh, I feel like something is there. And so people will get it mostly under that arm area and on the arm. And you're only going to get it on the side that you had the damage to the lymph nodes. So if you had cancer on the right side, you're going to get it on that right quadrant. So that includes the arm, the breast, under the arm, and the back. And the reason for that is how the system is made up, what we call watersheds. And so the watershed means that these collectors go this way, these collectors go this way. So you have this magical line, and that's what we call it, a watershed. They go in opposite directions. So these guys are only going to go to to the axillary lymph nodes. Like your head and neck is going to only go in that head and neck region. So you're not going to get like a leg swelling from having damage to these certain lymph nodes.
Because yeah, when I of course was googling everything. They tell you not to Google, but I can't not Google everything. So right before my double mastectomy, I remember seeing pictures of lymphedema like in the arm after a double mastectomy or something, and I was like, Jesus Christ, like this, like what? Something else. There's always something else that could potentially happen. So I was really scared of that happening. Not because I mean it doesn't sound like it's life threatening, but it certainly isn't good for you, when that's happening. So I was
Mhm.
really worried about it happening. Thankfully, it didn't. So I don't have any experience with it. But you mentioned the compression garments. And I want to go into that, but before I do, was there anything else that you were saying about that? Because my brain's kind of popping all over the place today.
Yeah,
But
yeah.
what
So
else
I
were
would
you saying?
say
Yeah,
you said it's not life threatening, and it isn't. It's not a life threatening diagnosis, and it's also there's different stages of it, and so um, the non life threatening of it is it isn't something that there's a cure for. So there's no cure for lymphedema, where some people come to you and they're like, "Can you just make this go away? This is give me a pill to make this go away." And so there isn't a cure for lymphedema at this time. They are starting to do lymph node like transfers. So surgically, like taking lymph nodes from other parts of the body and inserting them or placing them in to the area that was damaged. And so that's at its earlier stages. It's very much in the early stage, but that we don't have a cure at this time. So it's managing your symptoms. It isn't life threatening, like you said. It just creates, I don't know, it can lead to other injuries. One thing is an injury being like if it's on your arm, I have a, patient right now who's older, and that arm is so heavy. So now she doesn't use that arm, and then it leads to like shoulder injuries, and now neck pain, headaches. So that's like there's secondary things that happen from having lymphedema that can just really affect you functionally and lifestyle. Another side effect, which I did touch on the last episode, was getting infections, so cellulitis.
yeah,
Thinking that this is your lymphatic system is your cleaning system, it's your immune system, and so if you do have swelling and you're not getting that fluid out of the limb, then you're more at risk for getting an infection in that area. So that can be the life-threatening part of it. But in and of itself, you're having that buildup of fluid, and it is not something that is it's something that you want to decongest, get that out of there,
yeah.
functionally feel better, and prevent so you don't get infection.
Heather, I have a question. I can't remember if we touched on this in the last episode, but at least in my experience, I'm told not to, I had right side breast cancer, not to get blood draws or not to get my blood pressure taken or anything like that to reduce my chance of developing lymphedema. Can you kind of go into, I guess, how that increases your risk? Because when I've mentioned it at places who don't typically deal with breast cancer patients, they almost kind of scoff at me like it wouldn't be a big deal. So I would just like your take on that if you could speak to it.
Yeah, that's a great question. I think so. That is a perfect example of you're taking control of your body, and you know more about that lymphatic system than some healthcare providers that you're working with. And so yes, you don't those everything that you just said, taking that blood pressure cuff, any like tight clothing, pushing on that arm, you are increasing the stress onto that side, onto the lymph nodes. And what can happen, I always look at it like there's things that hurt the lymphatic system, and then there's things that help it. And so because you have to think of it, it's at a decreased, it's not as efficient. So it's at a state of it's already not efficiently running. And so when you take that blood pressure cuff, you're putting extra stress on the lymph system, and doing that over and over and over and over again puts too much stress. It could be that one thing that kind of puts you over the edge and leads you to that your system's like, I'm pooped out, I'm not working hard anymore, and you're going to start getting some swelling in that area. Going into that list, like what you were talking about, don't get blood pressure on that side, don't get sticks on that side, do not get an IV on that side. Could you imagine like putting an IV, right? Not only the stick, meaning the needle going in, we've now opened that skin for bacteria to get in, bacteria getting into an area that's already, not efficiently cleaning it, right? So that's one. Now putting an IV, now you're putting more fluid into that area that will now put an extra stress load onto those lymph nodes. They poop out. Well, now you're going to get you're going to get that chronic buildup of swelling. Other things that kind of affect it, flying in an airplane. So they say if you're going to fly for like a long distance, wearing
Yeah.
a compression garment when you fly.
I've heard of
So if
that.
you think when you fly, you're going up. So it's a decreased atmospheric pressure flying. It's like decreased atmospheric pressure, meaning it's not pushing as efficiently to get that fluid up to those lymph nodes. The decreased atmospheric pressure allows more swelling to occur, more fluid to occur in your whole body. But it doesn't matter the whole body, right? It matters this area. And so when you get more fluid in this area, well, now you're putting more stress on those lymph nodes, right? Um, so that's not moving, right? If like you're just stop moving this arm, right? That's another thing that kind of hurts the lymphatic system. Salty foods, a lot of alcohol, going into hot tubs, having radiation. These are all things that if you understand that list, like I always say, like you can do one thing, but like over time and keep doing them, you keep stressing that lymphatic system. It's kind of like think of it like it's just going to poop out. And it's like, yep, I'm not going to work overtime for you anymore. I'm going to go back to my regular shift and there's less of us. And so now you're going to we're just not going to work as efficiently. You're going to get a buildup of fluid.
Right.
That's a great question.
Thank you so much. That was such a good explanation. So I'm going to go more in depth now when they question. And I think it's just because I have a sleeve on this arm, so they don't want to deal with sticking it, which I totally get. But there's so much scar tissue here. It's not fun for me either.
Well, yeah. And if you have scar tissue in that area, right, that's another barrier, right? Like I'm actually working with one of my patients right now, just trying to massage fluid past a scar. She has a large, like a deep flap scar. Think of like a dam in your river, and
Mhm.
you actually have to like push that fluid through that scar tissue. So yeah.
So can you develop it at any time after let's just use me as an example because that's all I know. I'm 2 years out, give or take. Could I still develop it, or is it something that usually shows up pretty soon after surgery?
It typically shows up more after surgery and radiation, if you're going to get it, but it can show up years later. It's less common, but it does happen. I've had patients 5 years later come in and they're like, why do I have swelling now? I thought I was over this. I thought this was done with. Now I'm going to start having to deal with this. Um, and we don't exactly know why. We all have like a different makeup of how many lymph nodes we have in our body. So we all have different ratios of what lymph nodes need to work in our body. I think personally, I think it's more an accumulation of things that happen, right? Like that patient like did a lot of things on that list probably over time and then flew, to Africa and was like, why do I have swelling now? So it's just, I think it's more of an accumulation of things that happen. And then you get a pooped out system. Um, but I would say like, you can get it 5 years later. Are you going to get an extreme case of it where you're going to get like an arm that's 20% bigger? Maybe not. Maybe I do have patients who they have swelling like in the summertime it gets really bad and it just puts more stress on the system and now they get like this nagging this swelling that comes, so like maybe their arm is like 5% bigger, or maybe they just have to wear a compression garment in the summertime. So there's different levels of your lymphedema. I have patients that if they do not wear a compression garment, their swelling will get bad and it will just snowball and get worse. So the answer is yes, you can get it later, years later. Doesn't typically happen as often, and there's just going to be different levels of it.
Okay, thank you for that. Um, you mentioned compression garments. So let's kind of talk about those, like, which ones to wear, what, like an arm one versus maybe like a really tight bra one. I just had reconstruction surgery a few weeks ago, and like for those watching on YouTube here, like I'm wearing one that goes all the way down from like my boobs, my reconstructed boobs, whatever, all the way down to my thighs, basically, just because in this one, they took chunks of me from other places and stuck them up in my boobs. So I've got to have compression on everything. Um, would that, like, when they tell you to wear a compression garment after a surgery like that, is it primarily for the lymphatic system, or is it in order to keep things in place? Or, I mean, I just do it because that's what I'm told. But what is the whole purpose of the compression garments, and which ones out there exist? Like if you were to
Mhm.
go fly to Africa or China or something, and you're on a plane for forever, like
Mhm.
tell me about them. And tell
Yeah.
me if I should go buy an arm one for any reason.
Yeah, so there's so many different types of compression garments out there. It's also a little controversial of like some therapists will say you have to wear it all the time, every day, you know, you have to wear it. Other therapists like myself, I try and really get to know you and say, this is ideally what you should do. And see how your body reacts because we don't specifically know in a sense. There are some patients that you do have to wear a garment daytime and you have to wear a garment at nighttime. That's like the most extreme case. But there's times you could just wear it during your waking hours. And so when you're moving, right, you're wearing your compression garment when you're moving. So there's different wear schedules, I should say, and talking to your therapist to see what your best wear schedule is. When you're talking about just say you're going to fly, you don't have any signs of having lymphedema or congestion, but you are going to fly to China. Getting a compression garment just for that flight is a good idea. Or thinking of like, hey, I'm going to go up to the mountains and I'm going to so going up in elevation, and I'm going to like do certain things that are going to stress out my system. Yeah, maybe I'll just wear it for that. So I think it's a good tool to have. What it does, it's increasing that atmospheric pressure on that limb to help pushing fluid back up to your lymph nodes, right?
Yeah.
And so there's different, I'll kind of go into, I guess, some different types just to kind of break that down to make it more understandable. So there's different compression classes. And so how a compression garment is measured is in the measurement is mmHg is what you'll see on the label, millimeters of mercury of pressure. And so that's going to tell you what the compression class is. That's telling you how much squeeze or how much pressure you are getting on the limb or wherever you're putting the compression garment. So numbers that you look for is compression class 1 is like 15 to 20 mmHg is what you're going to see. That's a lower compression. 20 to 30 is kind of that standard that we use for lymphedema. So 20 to 30 mmHg is great for like a, so if you were going to fly, I would say, hey, just start with a 15 to 20. Okay. It's for someone that's trying to prevent any kind of just helping their lymphatic system, someone that has more like a circulatory, issues, um, flying to, China, going for a long run. I wear compression socks when I go for a long run. It just helps my lymphatic system, gets that fluid back up and for my long runs. So that would be a 15 to 20. 20 to 30 is you have lymphedema and we're trying to, prevent that fluid from coming down. You're going into a 20 to 30. There is a 30 to 40 compression class 3. That's for my patients who have such an extreme level of lymphedema where their skin is no longer bouncy. If you can see me, it's like you have some bounce, to your skin. You get to the point where those those proteins, so that's like kind of your bounce. You get to the point where your protein rich fluid, it gets so congested, and what that is a buildup of the proteins in your fluid that it's like it's hard, right? You don't have any bounce. Those patients need more of like a 30 to 40 compression class.
Where do
So
you
that's a little breakdown.
where do you find them? Or, like, is there a brand or something that,
That I
I mean, I
like.
can throw a link to,
Yeah,
or I mean,
sure. I've always enjoyed using lymphedemaproducts.com.
okay.
I kind of call them the Amazon of my lymphedema products. Compression Guru, they're local here. Compressionguru.com is also a great website. Um, but my favorite is lymphedema products. What it is it's gonna break everything down. It's gonna give you reviews. It's gonna give you really help. It's gonna give you all also the sizing charts, which is really helpful so you know what size you are. So lymphedemaproducts.com, I kind of direct my patients to that. That's kind of like the Amazon of compression. We all like to use Amazon, but Amazon does sell compression garments. I don't recommend going there. That you just don't know kind of what you're getting when you're ordering from there. I've had patients be like, I ordered 10 pairs of socks for $10. This is great. Not one of them works because they're like squeezing them super tight in the, calf and not in the ankle. And, so you just don't know what you're getting, but I've kind of seen some nightmare garments come from Amazon. So and then you don't know like what compression you're getting, the class. So I would say going to a more reputable. You can get them at pharmacies too. Certain pharmacies will sell them, and they have a fitter there. So that's a place you can go as well if you can find someone in person in your area. If not, what you're going to look for when you go online, like a lymphedema products, is you're looking for the size chart, and what it's going to tell you is where do you want to measure on whatever limb you're going for. Take your measurements and then line them up to the size chart to see what size you are. Every company has different sizes, different size chart. So you can't say, oh, like some of the, I typically use Medi garments. So Medi, Solaris, Juzo, those are all kind of like the name brand. When you're saying that, it's like you're saying Nike, Reebok, Adidas, right? It's just a
Mhm.
different companies. Some people, and if you don't like one company, try another one because they're not the same. There's different materials, there's different fits. So don't assume that if you try a Medi garment and you don't like it, that you just don't like compression. Trying other companies can be really helpful.
That's I'm really glad that you said that because I've bought all of mine on Amazon, and I now have a drawer, like an actual drawer just dedicated to compression garments, and that's always just for after surgeries. I don't have any for, like, the arms, but I have all these different ones, like, either just tops, bottoms, the full body suit, and there are some that I mean, you're right. Like I've spent a bunch of money that I probably should have just spent in the first place on one that I know works. I now have ones that I'm like, oh, that one's rough. Like I got to throw that away. There's no real compression, or it compresses in the wrong area. I found a few that are actually good. The one that I have found to have the most compression, and you were giving this guide, I feel like it would be like a 100 on this scale that you were doing is Skims, like the Kim Kardashian Skims. And I have like the full body, um, you know, it's not meant for compression. It's meant to be basically like a nowadays corset, right? And it is so tight, and it comes out of the bag like this big, like so tiny. You're like, there's no way that's going to fit my body. And then, with a little help and a little bit of jumping and deep breathing, you can get it on. But I'm like, I don't know if this is too much compression or what is going on. So it's nice to know that there is a scale out there. I'm not telling people to buy Skims or not buy Skims. This is not an advertisement for for Skims. Kim Kardashian is doing just fine. They don't need our help. But that is the one that I have found to have the most compression. But I also don't know if it's too much because it's crazy. So thank you for that. That's a long-winded way of saying thank you for that. That to know that there's an actual scale out there and companies that really do this. And it sounds like my money would have been better used going towards one of these name brand compression companies, rather than just 20 bucks here, 30 bucks there to Amazon, trying to find that one that really works
Mhm.
for me.
Mhm. That's yeah. I've seen it, and sometimes people can get lucky and get a good compression, off off of Amazon. But like you said, I see it more typically people buy 10 of them and then they could have just gotten like one good garment. Um, a little bit an exciting news, I should say, when it comes to compression garments is the Lymphedema Treatment Act just got passed last year.
What is
And so
this?
now yes, so in 2024, this year, you now can have your compression garments with Medicare and Medicaid will be covered
Ooh.
under those insurances. So, and a lot of times, private insurances will follow guidelines from Medicare. And so hopefully the private insurances will follow suit and have coverage for compression garments. So that's exciting. It used to
Very
be that
nice.
if you had, yeah, you used to have a wound under Medicare to get compression garments. And so now you don't have to. So it's
Yay!
exciting.
It's nice to hear
Yay.
when Congress does something. Instead of just
That's
this
correct.
stalemate bullshit all the time. At least some of them are,
Yes.
earning their pay and their health insurance for the rest of their life. Thanks, guys.
And it brings more awareness, right? Not
Yes.
getting something covered, like it's bringing more awareness to the lymphatic system.
Yep.
And yeah, so it's wonderful. Um, hooray.
Hooray.
A couple of, yeah, hooray. A couple other things. There's different types of knit when we're talking about compression garments. There's a circular knit versus a flat knit. And so a circular knit is more comfortable. It's going to be more, it's not going to be as rigid. So if you have like a true lymphedema that you're really getting swelling, getting a flat knit garment it would really hold you in better. And then there's also custom garments. So if you have like an oblong or not, shaped leg or anything that needs a custom garment, they do have custom garments versus off the shelf garments. The off the shelf was what I was explaining, the chart that you would look at for sizes. And then the last thing, if you do start to have swelling, one of the things that we do as a therapist, if you go to a therapist, if you have, when I'm saying like 10%, does that make sense? Like a 10% arm means like you're 10% bigger than the other side, right?
Yes.
Okay.
Yep.
Yes, that makes sense. So say you have like a 10, a 20% arm, um, we need to get that swelling out, and just doing a massage is not going to do it. You need to get that swelling. It's gotten to the point where you need to do other things. And what those other things are wrapping. So we use a lymphatic, it looks like an ace wrap, but it's called a short stretch bandage. It looks like an ace wrap. It just doesn't have the elasticity of an ace wrap. And what that does is you wrap it, you use foam underneath, and you're actually pushing the fluid out of your arm. So what versus like a compression garment kind of just holds you there, right? It
Yeah.
increases that atmospheric pressure. It's kind of just holding it to prevent it from coming down. The wraps actually push the fluid out of your limb. So you should notice a difference like day to day wearing a wrap. So you would want a professional therapist to teach you how to wrap yourself. You get compression, those short stretch bandages. You wear them 23 out of 24 hours a day. You're actually pushing that fluid out. And so now there's another option besides just doing the wraps. There's Velcro garments. So if have you ever seen people wearing like a Velcro garment?
I don't think so.
No. Yeah, not as common. But what it does is it's a Velcro garment. It's a thicker material, and it was actually mimicked. This is a fun story. It was mimicked after giraffe's skin, so the animal, a giraffe. If you
What?
notice, right, a giraffe has really long legs, and their heart is all the way up there, but you never see a giraffe with swollen legs, right? Just from the distance, right? Their skin is not elastic like our skin is stretchable, right? It's like really elastic, it's really pliable, right? It allows for swelling. Giraffe skin doesn't have that pliability to allow. That's why you don't see their legs don't get swollen, right? And so they actually created a garment mimicked after that. Medi did. It's called a circade garment, and what you do is you put it on. It's straps that you actually cinch like Velcro, and what you're doing with that, it's actually pushing that fluid out. So
Oh, that's wild.
another
That's really
option.
cool, though.
Yeah. Yeah. So if you have like swelling, like say you have like a 10%, you're getting up there, you're no longer just like, oh, I'm feeling some swelling, I need to hold this out. You actually need to push it out. That's another option, is wearing like a Velcro, like a circade garment. Other companies make it as well. That's also a garment that if you need to wear at nighttime, you can wear a circuit garment at nighttime, a Velcro garment at night. You do not want to wear just your arm sleeve. You don't want to wear that at nighttime because that can roll down and then create a tourniquet, and now you're hurting the system, right?
Yeah.
So Don't wear your compression garments at night unless you have a night garment.
Got it.
I think that's it.
Yeah, we are definitely going to put that link in the description so that people can find that and
Yeah.
so that I can figure out what is the right one for me because I've just been flailing. I mean, I think I've got a good one
I'll,
now, but who
yeah,
knows? I have no idea
I'll
what
help
the
you out.
level is. Thank you. Thank you.
Yeah.
Yay,
Yeah.
team.
Yay.
Oh, and for people that didn't go back and listen to the first episode with Heather, when you say, I'm talking to you, Heather, when you say therapist, we are talking about occupational therapist. So I
An
just want to throw
occupation.
that out there so nobody is
Yes.
confused that you're going to like your talk therapist. This is an occupational therapist. Just want to,
Or a physical
or a
therapist,
physical
a
therapist.
lymphedema, yes, a lymphedema therapist, someone who's been certified lymphedema therapist, a CLT.
Okay.
They've gone through the certification. You're getting someone on a medical side. You have to be a PT, an OT, or a massage therapist.
Okay.
Once you're one of those, then you can go and get your certification in lymphedema. So a certified lymphedema therapist, yes, is what we're talking about.
Okay. As we were talking, I just wanted to clear that up if people had questions on that. Um, we were also going to talk. You mentioned something about like protocols after surgery, and I think you have something else about like estrogen assistance. Or tell me about those. Start where you want.
Go into that. Yes. So after surgery, and there's different types of surgery that I kind of wrote down, and then Megan's like, "What? There's all these different, And so that's a discussion that you have with your surgeon and what we're talking when we're talking surgery is reconstruction, kind of going down the road of reconstruction. And so there's different types, of reconstruction after having needing to have your breasts removed. So having a mastectomy is when they go in there and they remove all of that breast tissue. You then can get an implant in there. If you don't want to do an implant, deep flap is what we talked about.
Yeah.
So it's a type of flap, right? That they're not moving the muscle. Do you want me to go into kind of some of the different types of
Yeah.
reconstructions right
Yeah.
now? Yeah. So like a deep flap, that's where we're not moving muscle. We are actually just it's from your abdomen, and you're moving a flap. So you're moving tissue to create a breast shape, in and not needing an implant. There's other types. Um, you need a specialized surgeon for that surgery. If you don't have one in your area, there's other types of flaps that include the muscle. So there's like a lat flap, a tram flap. What those are named for are the different muscles that they're taking to then move and create a breast shape. So a lat flap, that's your latissimus dorsi. So that's the muscle that's in your back, just below your shoulder, like behind your armpit.
Mm-hmm.
And so what they would do is take that muscle there, move it, the muscle, the skin, the fat, and move it to create that breast shape in the front. And then another one that they've used is a tram flap. So that's transverse rectus abdominis. So that's from your abdomen. Same location as a deep flap, but now you're taking muscle. And as a therapist, what you're concerned for is muscle is now you're functionally changing how you can move when you're moving muscle. So like that lap flap, they were seeing is women, you use your lats to like stand up from a chair, right? And so as you were getting older, you were having trouble doing that. So talk with your surgeon, but just it's a consideration when you're moving muscle, to think about how that's going to affect you functionally. What are you functionally not going to be able to do by moving that muscle? And if you could do if a flap is in your surgical options, looking at a muscle versus a non-muscular flap. Another two surgeries I wanted to mention that I've kind of talked to patients about is called the Goldilocks mastectomy. That's what the Goldilocks is, just like the book, The Goldilocks and the Three Bears. This is taking the two extremes of like having a mastectomy, removing everything and not doing anything at all, and having the implant. What this is what they're removing that tissue, but they're using the remaining tissue that's still there to create a breast without having to have an implant. So a Goldilocks is great for a patient who doesn't want to have an implant, but would like to have still some kind of breast shape, and maybe they were a large breasted woman before their diagnosis. They can use the remaining skin and fat to create a breast shape without having that implant.
Okay.
And then, yeah, the swim method, just another procedure. It's the same thing as the Goldilocks, but now you're preserving the nipple. So those are just some of the surgeries that I've seen
So it's not still
for
the breast
reconstruction.
tissue that they leave in there, it's just the fat? Because leaving the
It's just your
breast
skin.
tissue would that seems counterintuitive. Okay. All right. I just want to make
Yeah.
sure because when you said like use the remaining, I mean, you said it correctly.
Tissue.
I probably
Mhm.
misunderstood. But yeah, it seemed to me that that would be more of like a lumpectomy, but
Mhm.
that makes sense. Okay.
It's
You can like
yeah,
see
it's
me
removing.
processing it right now. That I've
Yeah,
never heard of the Goldilocks before, so
yeah,
that's really
that's a
cool.
yeah. Yeah, it's a great procedure for if you were large tested before, so that you have enough extra skin to use to still create that shape. But yes, you are removing all your breast tissue.
Okay. Okay.
Yeah. So um, uh, there's protocols for all of these different procedures, just like there's a protocol for lumpectomy and general like mastectomy with expanders. So working with a therapist is very helpful, just to go over this and understand what you want to do. I'm just going to go over like a general guidelines, but please, consult working with a therapist and really listening with your surgeon. It could be very surgeon dependent. I'm just going to do general. Okay.
Yeah.
So initially, right after having reconstruction surgery, or just a general mastectomy or lumpectomy, those first 2 weeks, you're in that tissue healing phase. So you're wanting that tissue. Swelling's going to occur; it's natural, and you want that scar tissue to actually start growing because we're trying to heal incisions, and heal the area. In that time, we're not doing any heavy lifting. You're not driving if you're on any kind of pain medications. The biggest thing is trying to just move those shoulders, right? Just getting some movement. I think what happens is we get very nervous after having that surgery. We just brace down, have our arms down by our sides, and brace. Um, what I'm saying is, please don't try not to do that. Try and have some movement. Swing those arms when you walk. Do a little bit of movement right to left. Just um, rotating those shoulders, squeezing those shoulder blades back as much as you can. In that area time, we don't want to bring our arms above 90 degrees or above shoulder height, but you can still move under that shoulder height, right? There's still a lot of movement that you can do um, in those first couple weeks. Um, One thing I is doing like an activity check is what I say with people. And what that is, hey, check in with yourself. If you feel like you're moving too much, your body's going to tell you you're going to be uncomfortable, you're going to be in pain, you might notice more like an increase of swelling. That's telling you, hey, maybe I shouldn't, just check in with yourself and say, okay, maybe I have done too much. But your body is going to give you feedback, if you feel like you've done too much. So just trying to get some movement in there. Once you get to that 3 week mark, the 2 to 3 weeks is a great time to meet with your therapist post op. You could start doing massage with them. But in that time, you could start doing generally some more overhead activities. So taking a wand or a ruler, or we call it a wand in therapy. It's like the stick,
Yeah.
right? And stick, putting your arms overhead, holding on to a broomstick or a hockey stick, whatever you have. So lay on your back, arms, use that stick and go overhead. A lot of time you're not going to pain. You're going to just stretch. Do not go to pain. Go to where you can go at that moment. Hold it there and come back down.
People can do
I
that
never
at 3 weeks?
3 to 4 weeks. Yeah.
Oh my god. Maybe I just have, like, a misunderstanding of, like, when like, what time was during that. I'm like I I feel like I blacked out a lot of that, but I feel like I had T-Rex arms and cording for a really, really long time. Maybe it really only was 3 weeks, but I remember trying to do those, like, overhead things, and I could not do much at all. But
Mhm.
then also I see
Mhm.
things with online of, like, girls that have had this done, and within 3 weeks, they're, like, lifting again, and they're at the gym. I'm like, "No, no, 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 that seems like 2 very big extremes." I was on one end of the extreme, I think, where just, like, nothing was moving.
But did you also have your wound? You had open that you needed to do that oxygen chamber, correct?
Yes.
Didn't you
Yeah,
have a
I
wound?
yep, I had that, like, my tissue under my left now breast, what
Mhm.
that was trying to, like, necrotize and die, and,
Mhm.
it was just as unhappy as I was.
And those are examples of like, yes, this is where following along with a therapist is, I mean, that's a great example. You have to look at your skin integrity. Can your skin handle this, that movement? In cases you can get like the necrotizing tissue, wounds. Like we don't want to be stretching wounds,
Yeah.
going to you. Do you know what I mean?
Yeah, that makes
So
sense.
those are examples that you can have a broad spectrum. I would say for the most part, though, a lot of people do get so scared to do any kind of movement that they then brace down. And then when I'm like, oh, yeah, you're okay to start, lift your arm over, and they're like, absolutely not. I've been here for 4 weeks. Don't ask me to go over here, right? Like, no way. And so that makes what you're saying, Megan, makes perfect sense. So just, yeah, being aware of that. So yeah. Other things you can do are, I mean, this might seem extreme. You're laying on your back, we call it the butterfly,
Yep,
you know,
I remember
a
doing
butterfly
that.
with your arms. What I even recommend, if you can, and if you're at the stage where you're laying on your back, um, so laying on your back is wonderful to do during these exercises because your shoulder blades or your scapula, we want them nice and flat and back and tucked in, right? When you're doing exercise, because your scapula is attached to bones like here that you feel, your acromion, right?
Yeah.
And so when we move forward, that forward posture, that acromion bone that comes forward because it's attached to your scapula. So laying back on your back, your scapula are in beautiful position to have great shoulder range of motion. And so it's great to do these exercises laying flat on your back. Just a little tidbit to help to get that scapula in good positioning.
Okay.
And okay, and then the other thing is T, a Y, W, like making shapes, with your arms. That's another good exercise to do with your arms. Then when you get to that 6 to 8 weeks mark, that's when you could start incorporating weights, lifting. Um, some depending on surgery. So like if you had a deep flap, some surgeons recommend waiting till 12 weeks. So again, very surgeon dependent, and listen to your surgeon always. But just in general, you could start doing some strengthening at the 6 to 8 week mark. You can also start doing some more intense stretches. So, like we call it a corner stretch, going into a corner, putting your arms above, you're trying to stretch the pecs in that situation.
Yeah.
And so you could do some more intense stretching.
Ugh, I remember doing that, like, putting my arm on, the I don't know what it's called. Again, this is menopause.
Doorway
I
stretch.
yeah, doorway stretch. I just lose words. But I remember putting my arm there and then, like, trying to push through, and you don't do it to pain, like you said, you're just doing a stretch. But I remember that hurting like a son of a bitch. Like, that was a lot back in the day. And this is funny because I haven't thought about this side of things for a very long time. It was just kind of part of that coming back to life after a double mastectomy. So as you're talking, I'm remembering doing these things. But yeah, like it was just a whole different feeling. It was like something I've never felt. I mean, I've played sports for forever. I know the stretch feeling versus the pain feeling, but this was just a whole new thing. And maybe it is because you have scars now involved in it. And, maybe like the big scars like I had that are really, really, really tough. But that was, it was so, sometimes it was really disheartening to be like, this is an easy stretch. Like, this is not a big deal. Like, I'm just doing hands above head and I can't even necessarily do that, you know? And I remember getting very disheartened by it. My husband's like, calm down, just do what you can today, then do it again tomorrow, and it will get better. And I'm here like, I will have T Rex arms for the rest of my life. Ah,
I
I
love
don't.
your husband. That is wonderful. Thank you, husband. It is. It's always one day at a time. It's so overwhelming. There's so much going on here. And so, yeah, one day, try the best thing to do is being consistent. And it's hard, human nature. It's not easy to be consistent and do the same thing every day. But trying to do each of these things each day, see where you're at that day. Tomorrow you may not get there. Maybe in 2 days you'll be way better. You just never know. But just trying to go listen to your body. Don't go to pain. Go to stretch. But if you keep at it, you will cheat. You will get there. It's just trying not to get discouraged, giving up, and saying, "Heck with it! I'm not going to do anything." Trying to listen to your husband, and doing those stretches each day. Thank you, Cody.
I'll tell him that. He'll be very happy that he got like a shout out on this. All right, we're starting to kind of get to time, but I want to make sure that we cover everything.
Did you
What
want
have
to talk
we
about the estrogen
missed?
blocking?
Yes, that's what I wanted to hear about.
Yeah. So if you have a hormone positive breast cancer, then your doctor may put you on an estrogen blocking medication. And in doing so, that puts you into menopause. And for this podcast, for young, it puts you into menopause at such a young age. So when you're going on those estrogen blocking medications, you really are looking at side effects of menopause. Estrogen is really our lubricant, in our body. And so what happens is when we're going into menopause or that estrogen blocking medication, you're thinking about dryness. And where does dryness affect you? There's different areas on the body. So first, from a therapist standpoint, functionally, dryness affects your ligaments, your tendons. It's like having a dried out rubber band, right? And so whereas before, you may have gone walk and you stumble and you roll your ankle on a curb, you jump back up and you're like, oh, I'm fine here, I'll keep walking. Now what may happen is you're walking, you roll that same ankle, and now you have a sprained ankle and you're like, what the heck happened? Why did that happen? Well, it's happening when you're on these medications, because those ligaments they're not as lubricated, they're not as stretchy of a rubber band as they were before. And so what you can do to kind of prepare for that, or as you're going through it, is stretching and moving your joints. So think of all your joints, think of all your, elbows, all your joints around your body, and getting them through their full range of motion. Once you have full range of motion, doing stretches to even further that. So 5 minutes, 10 minutes of yoga in the morning to try and do some different stretches for your body, can really be helpful because you're getting through those full range of motions, making sure you're a little bit more flexible with your movement to combat those side effects of the menopause or the estrogen blockers. Other areas, so your vaginal dryness.
I was waiting for
So
that one. I was waiting for that one.
Yes, estrogen stimulates the cells in the lining of your vagina to encourage the presence of lubrication, but it also for presence of good bacteria. So one, you might be more prone to getting an infection in your area, but also that lubricant during sexual activity using some kind of lubricant, adding that to yourself. So what you're doing there is trying to have sex while still feeling dry and kind of just pushing through that can eventually lead to an atrophy in that area, which would lead to, then they've noticed, are led to urinary incontinence.
Oof.
So use lubricant. Find one that you like, and yeah, add that to your routine.
Roger.
Another one, eyes, dryness, and dryness in your eyes. So using like an eye drop, that could be helpful. Dry mouth, also something that you can get, staying hydrated in that area. Using they have like these like mouthwashes that you can use as well. Um, yes. So I kind of forgot to touch base on the shoulder as well for dry ligaments, not just like rolling your ankle. Going back to that a little bit, I've had a lot of women present with a frozen shoulder after going on these estrogen blocking medications. So keeping good range of motion of your shoulder, shoulder impingement, rotator cuff tendonitis. These can all kind of happen, and people think, where did this come from? This came out of nowhere. Um, but it goes along with being on those estrogen blocking medications.
Yeah, I've already had on the ice, I like kind of rolled my ankle, and that was a few months ago, and it still kind of hurts and clicks. And I just feel like I got so old so quickly with this. And I very often forget that it's probably the estrogen blockers. I mean, I try to take my pills at night. That's where I remember the cancer thing, that was a thing that happened. It's just at night. And I try to forget it during the day, more or less. I mean, as much as I can. But yeah, when things are tight or they hurt and they never did before, I'm like, nah, I'm just getting old. And I've got to remember that is not your 38 years old type of thing. That's, you're in full blown menopause type of thing and you need to lubricate. I was going to ask, is there a specific, and again, people, we are not doctors, okay? Don't listen to everything that we say, but do listen to Heather on this. Is there a specific supplement or something that people should be taking for the lubrication? I mean, I've heard people say fish oil. I've heard people say coconut oil. I've heard people say, now I'm blanking on the name, but it was something that I gave to my dog all the time. Um,
Like joint, like
yeah,
there's
Like
supplements that can
CoQ10
be
or something.
helpful.
yes.
Yeah, yeah. I have there's things that can be helpful, like getting healthy fats. I know that's a big thing that we talk about. So getting like your fish oils, but also like some kind of like joint, like capsule medication, not medication, but supplements, can be helpful. From my standpoint, since I don't go kind of really into the nutrition, the supplement side of things, really getting movement. Keeping up with your movement, keeping up with your stretches, and getting through that full range of motion, adding some kind of stretching routine into your daily activity. I mean, it could be 5 minutes in the morning, just adding stretches. It just makes a world of difference, and it's 5 minutes in the day. I've even seen people get like congestion and get like buildup of fluid. They add stretching into their routine, and they feel so much better and decongested. So as far as like having the healthy diet, staying hydrated, there are those supplements that you can probably add that help with like joint comfort, I guess. But really, from my standpoint, adding that movement, the stretches into your daily activity.
Okay. All right. Thank you for that. I need to do better at that. I do it, but not all the time. And I need to make that a daily thing. um,
You are doing great, Megan.
Thank
That's the
you.
therapist in me. This is all information. That's why people are coming here. They want information, but we also can't be hard on ourselves. And, the more
We're all just,
information we know, we can make a better decision.
I was going to say, we're all just over here doing our best. I feel like I should get a sign and stick that up in my office. Like, you're doing your best.
That should be your
Sometimes,
post tomorrow.
yes.
We're all doing our best.
Well, I'll put that in the description too. We're just doing our best over here. Um,
You sure are.
Sam, do you have, before we kind of close out, because we always try to keep it at like about an hour, but Sam, do you have any other questions?
No, I think I'm good. Heather, you did such a wonderful job explaining all the answers to all the questions that we had. Hopefully, this brings more awareness to kind of what people go through and could possibly go through, and also more awareness to the preventative side, because I think that's really the key takeaway I took, from all of this conversation and just talking with Heather is prevent it up front, and hopefully you won't deal with a bigger issue later on. But if you don't do that, then you're more likely to have some issues with swelling and lymphedema.
Exactly. All right, Heather, again, this was fantastic. Thank you so much for coming on and explaining this stuff to us. For our listeners out there, if this sparked any thoughts, comments, concerns, whatever you've got, reach out to us. Reach out to us on Apple, Spotify. I think we're on, what else are we on, Sam? I mean, pretty much anywhere you listen to your podcast, you're going to listen to us. We also have our Facebook account and our Instagram account. So be sure to reach out to us on any of those. We check them all the time. And if you have any questions from this episode, we will be sure to kind of play the intermediary and reach out to Heather, see if she has any thoughts on that and bring it back to you guys. Or if this has sparked any other ideas for future episodes, let us know. We want to give the people what they want. So keep us in the loop with your thoughts, everybody. Again, Heather, thank you so much. It was very great to see your
Thank
face
you,
again
Megan and
today.
Sam. I'll
Absolutely.
say, if you want to reach out to me as well, my Instagram is Empower Your Lymph. And then I've changed my website to empoweryourlymph.com. So we'll be
Beautiful.
starting the new website. Yeah. And my email, empowerlymph@gmail. So please feel free to reach out as well.
I'll put all of those links in the description as well. Everybody reach out to Heather. She's a wealth of knowledge. And she's a lovely human being. All right. Again, thank you so much, Heather. Listeners, we will see you next week.
Thank you.